We have a 49-year-old female who has a history of autoimmune disorder or disease.
Only family history. She came into
Oh,
me only because her sister is a patient who has chronic Lyme and Hashimoto's, and her mom has Hashimoto's. And she saw her sister's thermometry results and she said, I feel great. I'm totally healthy, but I wanted to just come in and get this done. And of course, there's a lot going on. So,
okay. Well, you can see that it looks totally different than those last couple of patients we had with hepatitis and cancer. So this is more like what most patients look like, where they have a few block spots and some hyperregulation, but nothing so uh, difficult and with all kinds of messages in the regulation. So,
well, one thing that I did want to give everybody a heads up on is, there's a number of things going on in the breast page, and she does have implants.
oh,
So,
okay.
so that would
So,
be,
so, so implants don't. Hmm, is my webcam on, or do you see the
no,
thermometer?
we're seeing the thermometry.
Okay. Um, so with implants, you still see the regulation response because the nerve is going through to the capillaries, absolutely around the implant. So everything is still intact. So
Great.
the space that they make doesn't destroy the nerve that's going to the capillary bed. So we should see the same regulation. Now, if there's a leakage in the implants, then we can see some inflammation around that. Um, but usually, our biggest concern with implants is the body's reaction to a foreign body and to foreign substances, and then the plastics that are involved, creating an autoimmune disease. So, do you think that she has a family history of autoimmune, but
Hmm.
she has
She
no
has no
complaints with that?
diagnoses whatsoever.
She has no little complaints.
I mean, she was totally, if she does, she didn't want to share them with me at first meeting.
Okay,
She just wanted to get this test and have me tell her essentially, what I thought was going on.
okay. So it's a good thermogram. The glabella points are, they cooled paradoxically a little bit, but only a little bit, so it still is good. And then we want to look for the block spots. So can you tell me, where do you see block spots from the neck down?
From the neck down, all through the lymph area, obviously there's quite a bit in the neck, and then there's that one liver spot in the abdomen.
Very good.
Um, yeah, and that's
And
about
then
it.
the lower abdomen has one little block spot
Oh
here on the
yeah,
colon
yeah,
one. But you
that
notice
colon
this.
one, yep.
Colon 1, find it on your own body. Colon 1 is right next to liver 1,
Right.
and liver 3, uh, close neighbors. So when you see both block liver 1 and the liver, then you could think that the real problem is in the colon, because when it's really liver, then the colon will be normal. So in other words, the influence of the colon is greater towards the liver point than the liver towards the colon.
Got it.
So this makes me tend to believe that this is coming from the colon, and you should draw out the colon here. Let me see if I can get a little marker. And if I make this, if I make a little marker, let's see if I can do this. And I draw, oops, I didn't want to do that. Well, I'm not sure how to get this guy to go, but I draw the colon, so I draw the upside down U, and then I
Right.
draw this point, which is colon 1, and I can see that that's right next to the liver. So you always want to consider anatomy
Right.
when you're doing the whole test, because as you know, the upper jaw is related to the sinus, which is MS1 and 2. And so things can look like they're teeth, but they're really sinus. And it'll tell you which one it is because one will predominate. And
Mm-hmm.
then the lower jaw is closest to the lymph. And you see all these blocked teeth on the lower jaw,
Mm-hmm.
and you see more blocked, 38.5% blocked in the lymph. So we want to see if on the tooth page these really come out or is it really lymph. Now, so this is a tiny bit of a heavy metal, but it's only 4 and 5 that have a little bit, so it's not a heavy metal patient. So that's the block spots. The span goes from 31.5 to 37.5. That's 6. It's not enough to worry about. We worry 7 or more. And then the side difference, the cubital fossa, normal. The chest, we have some asymmetry, and especially here, see IC1 and IC2 are differing by 1.3 degrees
Mm-hmm.
in both measurements. So
Mm-hmm.
that's significant for heart, and that's what some stress to the cardiac function is. So did you listen to her heart?
Nope.
So that's one concern.
Okay.
Then the side differences in the head, there aren't any. You'll see, oh, there is one, the temples. You see how these temples are about 1.3 degrees different.
So that's the pituitary.
Yeah,
We were.
so she has an endocrine imbalance and something with cardiac. And then this block spot in the liver, which we're not sure about. And then she has this hyperregulation in the kidneys and in the pancreas. Hyperregulation in the pancreas, toxic pancreas is usually from pesticide poisoning from foods.
Hmm.
Hyperregulation in the kidneys can be from anything, but that means toxicity to the kidneys. So you need a detox therapy.
Yeah, I mean,
So
I suspect her diet is not very good either, so.
yeah, so in the upper jaw, she has 34 to 34.5, so it's half a degree, and no difference in the lower. And the breasts are fine at 0.3 different. So far, we have the major effects or the major results that we want to look at is something with a cardiac. I would, listen to her heart and ask her if she has any symptoms. Um, and I would do an endocrine analysis, and I would look at this 39% blocked lymph. The thyroid looks perfect. You see how this thyroid is going higher after each one? So this is what how the thyroid should be, but she has the thymus point blocked, which is going back to the lymph. So so this is very much showing us that there's some kind of immune deficit. Is it a virus? Well, the ethmoids are symmetrical, so it's more in the bacterial world than the viral world.
Yeah, I mean, I see those ethmoids cold on almost all of my
Yeah,
clients. It's funny.
that's okay, but if they're very cold, like near the end of the graph, then you need to look at something that's been immune deficit for a long time. But
Okay.
it's not too unusual to just be cold. So we see this toxicity present. That's all that hyperregulation. And then we see the heavy metal, but remember that was only kind of barely moderate, if anything, mild, because it was such low numbers. And I think only in 2 regions. Was it in 2 or 3? 2, I think, out of the areas 3, 4, 5, and 6. And then we see this severe vulnerability to physiologically compensated. This could be a terrain problem that's conducive toward the lack of control of regulation. And that's because we see different areas with different mixed results. That's the increasing loss of regulation. Then we see the endocrine disorder. Then we see this, we see a little bit of a cerebrovascular that's coming usually from the CP points. we'll take a look at that. Then we have just some minimals, and then we do have a viral signature because actually the ethmoids, I think on the first measurement, are a little bit asymmetrical. So
Yeah.
sometimes that's included in the signature. So the signatures are directly from the historical Dr. Bloom and Dr. Rao and Dr. Sauer and all the experts, and sometimes it will show there's some possible virus. She has some sinus involvement. She has the lymph block. Um, then here's the cardiac problem. That's that big asymmetry. And electrophysiological means possibly magnesium deficiency, possibly potassium, but something's happening to her heart rhythm. I would at least do an EKG, if not an echo, on it after I listen to it. And the pancreas toxicity is there, and now the putrefaction. That is important because if she is having stool that's sitting in her gut for more than a couple of days, you'll get this pattern, and it's right here in the descending colon. Do you see these steps going upward?
Yeah.
Well, going downward is fungal, and going upward is putrefaction, which means that stool is sitting here and re-intoxicating her. So when that comes out, I always do things. I think magnesium would be a perfect thing because that can see if we can regulate the heart. Do you know if she has normal stools every day?
Um, she didn't, I mean, I always ask about bowel health and she didn't have any complaints. But this is a patient that I spent most of the time doing the exam, and when she comes back next week, I'll, get a deeper history on her. So,
And and there's not much in the dental, only these teeth that might have been residual to having amalgam, and there's a little bit of a side difference. So nothing really rings out and goes into the speckled or the dotted look to really be concerned. Her breast area is 7 out of 12, which with no block points. There is that half a degree right to left asymmetry, possible um, possible molar, but that was one of the block teeth. And then we get into these are lymph, and then we had that liver point that was blocked. So I would say that if you treat the lymph, then you're going to take this down to where it really is because we don't really see anything clear here, and it's being crowded over by possibly gut issues or lymph issues.
right. So even though there's 7 of 12, it doesn't seem like it's really in the breast itself. It's more distal issues, right? Distant
Yeah,
issues.
yeah, and the way you can look at that is when you refer back to the thermography and also see this, we have the lymph influence, we have the endocrine influence, we have the organ tissue influence, which is that liver point being blocked. We have a little bit of heavy metal. So it's all being kind of fulfilled more that all you have to do is treat this and you retest in a month or 6 weeks and you should see this come way down. So it's only there's stress on the breast. So if she went this way for 5 years or 10 years, then this would solidify. But
Hmm.
it's only a signal right now that's
So the
uh, on.
physiological compensated signature is coming up as a sum total of all those other things there, or is
No,
that
no,
okay?
no. You see, we have a block point here with uh, here we have different forms. Here we have different forms. So as you have different forms of regulation within a single region, then it pumps up the physiological
Okay.
stress.
Okay. So
Um,
that's one of the ways that
and
that
also,
comes up.
yeah, and also with the teeth, do you remember that we wanted to know, well, is the teeth really, are these lower teeth? really something that we're concerned with. We may be concerned with the difference between these two, but it's only 1 degree. It doesn't quite make it. I would look at these blocked teeth here on the right lower,
Hmm.
but since the immune system and the lymph has so much blocked regulation, 40%, I would concentrate on the lymph and then retest.
Great.
So I would treat the lymph, the gut, and detox kidneys, and do an endocrine panel.